Okay. Hi, everyone. So this special needs project is on food allergies. And these happen when the immune system mistakenly treats proteins found in food as a threat. And as a result, a certain number of chemicals are released in the body, and these chemicals are what cause the symptoms of an allergic reaction. And allergic reactions can happen in anyone and with any type of food. But there are several that are most common, and that's going to include your milk, eggs, peanuts, tree nuts, fish, shellfish, some fruits and vegetables, wheat, and soy. And these allergies are extremely common, and they affect about 5% of all children and 8% of all adults. And there are several risk factors that can intensify allergic reactions or cause someone to become more predisposed to obtaining an allergic reaction to a certain type of food, and that's going to include deficiencies and insufficiencies of vitamin D, having a diet full of unhealthy fats, obesity, increased hygiene with food, and the timing of the exposure to foods. And the timing of exposure to foods basically just means that if anyone is exposed to a certain food at a certain point in their life, then they're more likely to obtain a food allergy to that food. And an example would be if you expose a baby to cow milk protein before they're 6 months old, then they're extremely likely to develop an allergy to that cow milk protein later in life. And as well, other genetics and lifestyle issues do play a role in someone's risk factor of obtaining an allergic reaction to something. And they affect 4 areas of the body, and the most common one being the skin, and this is going to be your visual cues such as hives, eczema, getting a super swollen and red face and extremities, and having really itchy lips, tongues, and mouths. And with your gastrointestinal or your GI tract, you're going to experience things like belly pain, nausea, vomiting, or even diarrhea. With your respiratory system, you're just going to feel symptoms of like a runny or stuffy nose. You're going to sneeze, cough, wheeze, and just have general shortness of breath. And arguably the most serious reactions come from your cardiovascular and your nervous systems, and those are going to include being extremely lightheaded or even fainting. And with the more extreme reactions, these are known as anaphylactis, and these are going to include your life-threatening symptoms. So these are going to be any sort of constriction or tightening of your airways. This is going to include a swollen throat, difficulty breathing. You can go into shock if your blood pressure drops severely. You can start having a rapid pulse, and you can feel symptoms of dizziness, lightheadedness, or even go unconscious. So there are 2 true types of food allergies, and these are going to be your IgE antibodies or your non-IgE antibodies. And in an IgE food allergy, this antibody is released by your immune system. And with a non-IgE food allergy, these antibodies aren't released, and other parts of the immune system are used to fight off that perceived threat. And all antibodies are their little types of blood proteins that are used by your immune system to recognize and fight infections. And while the most effective way to prevent symptoms is to remove that food altogether, but this can have varying effects on a child's nutrition, because if you were to remove something such as eggs or peanuts, like these aren't going to have a huge effect on that child's nutrition, because both of these, well, while they're both a super good source of protein, they can be easily replaced by other alternative sources. But on the other end of the spectrum, if you have something like milk, which is a child's main source of calcium, that can be a little harder to find good alternatives, but there are a bunch, such as things like nut milks, or you can even just include a lot more green leafy vegetables in a kid's diet. And honestly, nowadays, many foods and drinks are fortified with extra calcium. And unlike special needs such as diabetes or cystic fibrosis, having a food allergy doesn't have an effect or an impact on your physical activity. And while there's no treatment for a food allergy, there are lots of ways to manage it. This is going to include your antihistamines and bronchodilators, which are going to be inhalers and other types of inhaled steroids. And honestly, at the end of the day, having a strict avoidance of that allergen is the only way to avoid reaction. But I mean, mistakes happen, things happen. So educating the family and your community is absolutely essential. This is anything from notifying a babysitter of a child's ailment or their school or your work or anything like that. And you're still going to want to be reading. You're still going to want to be reading all the ingredient labels for all of the foods. And these management strategies for household and community settings should be clear and in place at all times. And in terms of long-term implications or complications, most food allergies affect younger children under the age of 3. And if they have an allergy to something like milk, eggs, soy, and wheat in this early lifespan, that they're honestly extremely likely to grow out of it by the time they're school age. And peanut and tree nut allergies are the most common types of allergies, and they're also the most long-lasting. And if any of these allergies are to develop during adulthood or persist into adulthood, so past this school age, they're extremely likely to be lifelong allergies. And there's several steps that you always want to follow to make sure that you're going to avoid any type of reaction if you can. And the first step is to let the staff know. So if you're going to be booking a table or you're going to be booking a hotel room or a catered event or anything where you could come in contact with this type of food, you want to make sure that the staff knows about any allergies, and you want to ask for a firm guarantee that the specific food won't be in any of the dishes served. But then again, you also want to be super careful because things can be overlooked, such as some desserts containing nuts and some sauces containing wheats and peanuts. And you always want to prepare for the worst. So anytime you're going to be exposed to food, you're always going to want to take your anti-allergy medicine. And this can include things such as an adrenaline auto-injector, which is commonly known as like an EpiPen. And you can also do the taste test in older kids. So you just kind of try to rub it on their lips a little bit, and if they experience a tingling or a burning sensation, then there's a good chance that that food will cause them to have an allergic reaction. And this is our Works Cited page. All of our information was found from these sources, and thank you for listening.